Okay, so now let's moving forward to stages of eclampsia. As we have learned in earlier lecture that what is eclampsia. Eclampsia is a generative, means developing complication arise from preeclampsia, when preeclampsia complicated with convulsion or coma, which is called as eclampsia, called as flash of lightning. I have said that seizure threshold in a cortex area which activates and which eventually leads to convulsion and fits due to more protein, more generation of acetylcholine, more and more abnormal disturbance between prostaglandin hormones, and other than that role of seizure neurons, excitatory neurotransmitter glutamate and aspartate. Okay, and in stages of eclampsia there are 4 stages. Premonitory stage, which is a pre-stage, which arising stage, as we can say, which lasts for 30 seconds. Second one is a tonic stage. In that most your body goes into tonic means spasm, which lasts up for about 30 seconds, same as premonitory stage. Third is a clonic stage. In that not only spasm happen but also relaxation, twisting also that happen. In clonic stage there will be spasm, means contraction of muscles, also relaxation, and then again spasm means one contraction in between one relaxation, so it lasts about 1 to 4 minutes. So eventually it will be a serious stage because it will lead to stage of coma. So here there are 2 primary stages in that we can easily treat. But in this rest 2 stages, that will be serious concern. Like if lady will not get ambulatory services, then she will go into coma, and also fetal death can be happen. So in premonitory stage, patient become unconscious, like fainting, also twitching of muscles like face, tongue, and also limbs. Why? Because it generally happen from seizure cortex, in which between parietal lobe and frontal lobe, which eventually attack on facial muscles, and some nerves which attach with face, tongue, and limbs, most probably upper limb part. Also eyeballs roll upward or turn it to one side and become fixed, just like a doll. Eyeball become fixed, like or turn it one side, just happen in a seizure. It lasts about 30 seconds. After that tonic stage occur. It is a most contractory phase. In this, trunk leads to in a opisthotonous position. Opisthotonous means back upward, like C curve. Then limbs flex, totally flex. You know about what is flexion. Flexion means bending at 90 degree. And the hands clench. Hand means just like they, as you can see in a picture. Clenching means just like twisting but in a opposite manner. Also eventually it leads to muscle spasm, so respiration ceases, respiratory arrest happen. Also because of muscle contraction, so circulation will be slowed down. Circulation cannot be easily circulate to everywhere, so cyanosis, bluish discoloration happen. As usually eyeball become fixed. It also lasts about 30 seconds. And then serious stage, in which also contraction, in relaxation, also clenching, all things are happen. So all the voluntary muscles undergo alternate contraction and relaxation. Twitching, first twitching starts in the face, just like this premonitory stage. Then involve one side of extremity, and ultimately the whole body involved in convulsion. Patient can be easily thrown out of bed if not cared for. As I can say, this is a very serious stage. Biting of tongue occurs due to opening and closing of jaw. Breathing is stertorous. Blood stain, frothy secretion fill the mouth. Also blood come from mouth. Cyanosis gradually disappears. Respiration is labored and noisy. Temperature may rise to 40 degrees Celsius because of fits, means convulsion. It lasts about 1 to 4 minutes. Now this following fits If patient will not easily get treated, then patient will go in a stage of coma. It may last for a brief period, or other deep coma may persist till another convulsion. Okay, like this is a clonic stage. It's a brief period of fit seizure happen. All things happen in combined in premonitory and tonic stage. So if it lasts brief period and then other deep coma may persist till another convulsion, means it will last 2 when next seizure or fits will occur. Till then person remain in coma. Then patient appears to be in a confused state, as usually coma stage. So after the convulsion and fails to remember the happening, it may be followed by another fit. The fits are usually multiple, recurring at intervals. When these occur in a quick succession, it is called as status eclampticus. Okay, note down this. If fits are usually multiple, recurring between intervals, and then eventually quick relaxation, quick contraction, which when it called as a status eclampticus. Okay, so these ones are stages of eclampsia. Okay, in next part we will learn about complication and management of eclampsia. If you have any question, then you can ask me. Till then, happy learning.